Welcome to our Public Health Emergency Discussion Series, sponsored by HHS and the Assistant Secretary for Preparedness and Response. I'm Lark McCarthy, and today we're going to address functional needs for at-risk individuals in public health emergencies and disasters. We're all too familiar with the images, or maybe we've even been in situations where communities were faced with a disaster that required public health support. Emergency planners and responders have to take into consideration many factors when responding to a public health emergency. Today, we'll explore the Functional Needs Framework, which allows planners and responders to take a comprehensive approach to disaster management. This can be used on the individual, local, state, tribal, and federal levels. Our guests will explain why emergency preparedness and response for at-risk individuals is more than labeling or segmenting sectors of the population into a special needs category. Let's meet the experts ready to explain. Brian Parsons is a senior policy advisor in the Office for Civil Rights and Civil Liberties within the U.S. Department of Homeland Security. Dr. Andrew Garrett is the Deputy Chief Medical Officer of the National Disaster Medical System here at the Department of Health and Human Services. And joining us from Sacramento, California is Richard Devylder, Special Advisor on Access and Functional Needs Coordination within the California Emergency Management Agency. Thank you all for joining us. All right, so Brian Parsons with the Department of Homeland Security. Let's start with just a quick explanation. What is the Functional Needs Framework? What does it mean, and why do we need this approach in emergency planning and response?
Thanks, Lark. I think it's important to point out that this is an approach that moves us toward looking at the diversity and acknowledging the diversity of the community, and moving the question and the preparedness planning toward where are the needs of the community. So if we start by engaging the community, the members of the community themselves, and particularly in the face of an ever-diversifying population, we can find out where the functional needs are. And by functional needs, here I'm talking about the need for accessible communication, for the maintaining independence by the individual, access to medical care, some individuals needing supervision during an emergency, access to transportation. These are the kinds of things. When we think about taking a functional need approach, there are a couple points here. One is you're going to be seeing this increasingly from a federal policy standpoint because this is an approach that's being adopted by the Federal Emergency Management Agency, Department of Homeland Security, Health and Human Services, and the federal interagency community is moving increasingly toward getting beyond the labels of the individuals and more toward matching the resources to where the individual needs are. And this lines up nicely with civil rights protections for individuals who will need various supports to maintain their independence before, during, and after the emergency. And the last thing I wanted to point out was that by taking this approach, you essentially widen the lens of preparing inclusively for the entire community. So suddenly we start thinking in terms of the common needs faced by individuals with limited English proficiency, and making sure that historically marginalized populations are not left out of the emergency planning process.
So Brian, just following up on that, does planning for functional needs mean that everyone who has a disability has a functional need in an emergency?
Well, not necessarily. That's where we slip back into the sort of the labeling trap of the past. Let me give you an example. You could have somebody who is a wheelchair user who may have access to their own personally owned vehicle. So in an evacuation scenario, they don't have a functional need for transportation from the local government. But when they arrive at the general population shelter, they may very well have a functional need for an accessible shelter to ensure that they can move the wheelchair about. So it's really situational, and we can't just associate a label with the functional need.
Great example. Dr. Andrew Garrett with HHS, can you explain why the term special needs is a challenge to those who prepare and respond to disaster?
Sure. Like we already heard, the term special needs is a label. It's a catch-all phrase that really came about when services that were designed to provide emergency response for a community turned out not to meet the needs of everyone in the community altogether. So you either fit the system or you became someone who had a special need. That term then got socialized a little bit, and it turned into a label for shelters and a personnel description for people that were in charge of that catch-all group of the population. The challenge there is what we're trying to do is use one term to describe what's a very heterogeneous population that may be over 150 million people in the United States. And depending on who you talk to, somebody with special needs might be a child or an adult, or a child or an elderly person, or someone with chronic medical illness, or somebody who has a technology-dependent condition, maybe somebody who doesn't have access to a vehicle or doesn't speak English. So depending on how you define the term, has everything to do with
it was
how
really
you can
too
meet their
broad
needs.
to be useful in an emergency.
Yes, ma'am. And when you're trying to prepare for disaster, you need to think about goals that need to be met, and having the label doesn't facilitate that. So that's the main problem with the label.
All right, so under this functional needs framework, are there overall steps that planners and responders can take to help people maintain their functional independence?
Well, I think when you're talking about functional independence, you're trying to talk about lessening the impact of the disaster on the individual and on the community and to responders in general. So really what we're talking about here is an opportunity to look at where can we intervene to reduce that impact. So you've got individuals who may have a functional need that's addressable with a very limited intervention up front, something that can be mitigated, whether it's access to a vehicle or access to a special medication, where if that is neglected, then later on down the line it becomes a much more heavier impact from the same condition. So somebody who didn't get a medication they needed up front now has to access 911 services later on during a mass evacuation, for example. It's much more difficult to get the right kinds of services, much more difficult on the response community to be able to provide that.
To provide it. Yeah. With that, let's turn to Richard Devylder in California. So Richard, in your experience in California, how have you applied this functional needs approach?
Well, one of the things that we've done is develop a concept in teams which we call functional assessment service teams. And the intent of those teams are to actually go in to general population shelters and work in collaboration with the shelter management staff and also with the individual residents in the shelter to be able to identify what are functional needs that they need in order to be able to maintain their independence as best as possible in a general population shelter. And really, a FAST is made up of both government and non-government personnel. We really encourage that it be at a local level. So for California, it would be county personnel and nonprofit organization personnel who have experience in a variety of different types of disabilities and who can really address the needs. And the other key thing about those teams is they should have a really good understanding of the service system and also of the different types of vendors that are around so that they can get the equipment and the resources that the individuals may need in a timely manner. Because our real goal here is, number one, allow people to maintain their dignity by remaining in a general population shelter, and number two, not unnecessarily putting a surge on the emergency medical folks.
Right. And that really is a big key, that you want to have the medical personnel available to people with medical needs and not someone, for example, who simply has a language problem. Is that sort of the bottom line, Richard?
Absolutely, because really where the mistakes have been made in the past is that we've always identified disability as being medical. And oftentimes it's not medical, it's just a functional need. So for instance, I use myself as an example a lot. I have no arms or legs, but I have no medical issues. I take no medications. What my needs really are is functionally based. And I've had many planners say to me, in their environment, they would put me into a special needs or medical shelter. And in our opinion, for those of us who have really worked around functional needs, it's really unnecessary and inappropriate to force people into a medical environment when it really is just about a functional need.
All right, what a great personal example. Thank you for sharing that. Let me turn to Dr. Garrett, because I know you've been deployed to many disasters and you've seen the need for the functional needs framework in the field. So explain how this is useful.
Well, I think an example we can think back to personally is the experience we had with Hurricane Katrina and the experience we had at some of the shelters around children. This has been an issue that's been looked at a lot over the past few years. Children represent a very sizable part of the population, and what happened in many of the shelters was that the needs in terms of the basic consumables for a toddler, for a baby, things like diapers, formula, bottles, etc., although those existed in the shelter supplies, they weren't there in adequate volume to really meet the needs of the community. So, if we looked at the functional needs of the pediatric community, we have to think about it in terms of what do they need, but also what's the actual amount of something that's going to be needed in the community that's being cared for. So if you're running a shelter that will have, potentially 10,000 folks, we have to understand what the percentage of children is going to be and what their needs are going to be and adequately plan for it. So it's a question of looking at what the needs are, but also what are you going to need to be able to actually bridge the gap for what they're going to need to have the supplies.
That's a good example of Katrina, something I know that you worked on.
And then looking forward.
Yes, looking forward.
Ways that this can work potentially better in the future. Functional needs come into how do we look at a community and assess in the response mode what type of services we're going to need to provide, and this comes in from the federal government perspective. One of the ways this has been operationalized, at least from the perspective of Health and Human Services, is through the electronic medical record. When we have medical teams out in the field performing encounters, they're able to look at what the community needs are by assessing, by being guided by the medical record to determine what the functional needs are of the encounters that are being made. As we look at that information in aggregate, then we can determine a little bit better what type of services may need to be provided, and also to provide information to the local responders to be able to improve that situation.
Great. Let me turn to Richard Devylder back in California. I understand that FEMA will be releasing a publication on functional needs support services. What can you tell us about that?
That's correct. It's a publication called Integration of Functional Needs Support Services into General Population Shelters. And there was a very good collective team that put the publication together. It included Department of Homeland Security. It included FEMA, Health and Human Services representatives, the American Red Cross, and also different states in terms of putting it together. And the real purpose of the publication is to do what many states and local governments have said is needed. We need guidance about how do we meet the needs of people with functional needs in general population shelters so they can maintain their independence there. And what we've heard here in California over and over from our emergency managers is, please don't tell us what we're doing wrong, but please tell us how we can do this right, because if what people want is for people with disabilities and people with different types of functional needs to be in general population shelters, then show us how to do that. And that's the intent of the publication. And the intent to roll it out is in July, August, and September, FEMA is going to be holding regional meetings across the country to meet with the regional folks who have responsibility for both emergency management and for sheltering so they can better understand the publication. In addition to that publication, there's going to be a sister publication to it, which is personal assistance services in general population shelters. And that is really one big issue, because the one thing someone like myself needs is someone to provide assistance so that I can get dressed, take a shower, get food, and those sort of things while I'm in a general population shelter. So we're also going to be providing guidance through both of those publications on those very big issues.
Great. Well, I have a question for all of you, and Dr. Garrett, why don't I start with you? So what does function needs planning mean for personal and community preparedness?
It's a very good question. As we look at how do we meet the needs of the community during a disaster, and we said up front, there's some people that think that that people who have some sort of functional need represents a very, very significant part of the population. So we have to look at the role of the individual versus the role of the community versus the role of the state and federal government. I think as federal folks, we need to be involved in helping set the tone for how individuals engage themselves in disaster preparedness and response. So while we know from past examples, and also just the reality of it, is that the federal government can't meet the needs of everyone during a disaster. That's an event that has to happen at the local level. So functional preparedness allows us to develop a framework where an individual can work with the resources they have available to them, whether it's their family, whether it's their community, or their clinician, or their school, or those that live on the same block, to be able to identify those who are in need, characterize what that type of need is, and then work together to achieve a resolution to that. So again, empowerment for individuals that are involved in disaster, that's what's going to lead to the community resilience that we're expecting. You can't necessarily reach to an outside agency that's going to be able to provide that. We need to all work together, and that individuals really is where preparedness becomes operational and where the success is going to be.
If I could just follow up before I turn to Richard, because it's a related area. I know you're hopeful that using this functional needs framework will have a practical effect where you avoid, for example, some of the privacy concerns or concerns over HIPAA. Can you explain that, how that also plays in?
Sure. When you look at a framework that uses the definition of what someone can or what someone will need to be able to have the best chance to recover from a disaster, we can look at an individual or a community or a group and identify what a gap is without having to label it as a specific diagnosis, or say an individual has something where you don't want to share information about what kind of medication they're on or what kind of condition they may have or what type of medical care they're receiving. You can still look at the gap, and the gap might be access to medication, or the gap might be transportation like we talked about, or it might be access to a specific type of therapy like dialysis. And we can do all that without naming names and talking about specific diagnoses.
And a person's much more likely to cooperate if you say, I need that medical needs, and then privately you can disclose something, versus before it was almost disclosure up front.
Sure, it was almost like if you wanted to join a list of somebody who might need special help during a disaster, you had to put your name on there and what your diagnosis was, and what type of medication you needed excess of, and then wait for the community to provide that need for you. So much more empowering to the community and promotes resilience at a much more organic level.
Richard, let me turn to you on that question. So what does this functional needs framework, mean for personal and community preparedness?
Well, what's really important, and what I say to people with disabilities and people who may have different functional needs, is it's really critical for you to identify ahead of time what your needs are. And what that will really lead to, and what I really encourage individuals to do, is to make sure they develop support teams around them. We hear a lot of times about having a buddy. Well, a buddy is two-person focused, and it can cause a lot of issues during a disaster if that buddy's not available. So wherever you are and wherever you spend a lot of time, whether it's at work, school, home, a favorite bar you like to hang out at, it's really important that those who are around you a lot understand how to assist you. So if you have a visual impairment, how to guide you during an emergency to get you out. If you use a wheelchair, how to disengage your wheelchair in case you need to be manually pushed. If you need to be lifted, we don't encourage lifting unless it's absolutely necessary, but if you need to be lifted, how do I assist you in terms of lifting you out of the wheelchair and carrying you to wherever it is you need to go? So it's just very important that the people around you know how to assist you. And even at home, we don't like to talk to our neighbors a lot these days, but it really is critical for your neighbors to know how to assist you, because at the end of the day, your coworkers, the people who live near to you, the people you go to school with, the bar that you hang out with, those are really the individuals who are going to be your very first responder. And in order not to be dependent on government to get you out, those individuals around you really need to know how to assist you. So we need to stop being shy. We need to engage people around us and make it work.
Yeah, what a great point. Think beyond that one buddy system. We all need lots of buddies, don't we? I love that, Richard.
Absolutely.
Brian Parsons, give us a perspective from Homeland Security, especially in the framework in terms of civil liberties and civil rights.
Well, I think one piece we need to bear in mind is that we've talked a lot about planning for the population, but planning with the population, finding mechanisms to engage the community and to get people involved at the local level. There's a lot of community-based organizations that represent individuals with functional needs. They're very interested in getting involved with emergency planning at the local level. There needs to be a dialogue cultivated there, and we're always encouraging that point.
Okay. And a great point on which to end. So we thank you all. You each brought some great expertise and insight into today's discussion, and we do want to thank all of our guests. Brian Parsons, Senior Policy Advisor in the Office for Civil Rights and Civil Liberties within the U.S. Department of Homeland Security. Dr. Andrew Garrett, the Deputy Chief Medical Officer of the National Disaster Medical System right here at the Department of Health and Human Services. And from Sacramento, Richard Devylder, Special Advisor on Access and Functional Needs Coordination within the California Emergency Management Agency. In closing, let me add that emergency planners and responders are finding it useful and practical to move away from labeling individuals as having special needs. Now, this shift toward the function-based framework allows emergency planners and responders to match resources to individuals and communities during public health emergencies and disasters in a more accurate and effective manner. Now, this framework, which is adaptable, scalable, and flexible, includes 5 main functional needs. Think of it as CMIST: communication, medical care, independence, supervision, and transportation, CMIST. This framework encourages personal preparedness and can be used on individual, local, state, tribal, and federal levels. Thank you again to our guests. For more information, please visit www.PHE.gov. If you have questions, please contact abc.info@hhs.gov. I'm Lark McCarthy. Thank you for watching, and please browse the PHE.gov website for others in our public health emergency discussion series.